and we are live. That's fun.
We are live. Hello. And welcome
Hello.
to Art and Heart of Menopausing.
Indeed. And I'm really excited about today because we're going to be talking about acne, which is a horrible thing. But when I started to, dig a bit deeper into the Chinese medicine, I was like, oh, this is really interesting and so much deeper than what I could find from a Western perspective. Really, really interesting. And so I'm looking forward to sharing this with our audience today. I was like, insightful stuff.
Yeah, it's fascinating to see the role of the skin in Eastern traditions or in other traditions, whereas quite often everything in the West takes, well, besides being compartmentalized, but if it's not the heart or the brain or or now it's more, but these organs, if it's not those major organs, then it kind of gets a backseat to everything. And even though that we understand that the skin itself is the largest organ of the body, it's the most active immune protective system of the body. So little it's been relegated to estheticians, and it's not. It's a lot bigger than that.
It is, or that there's a serious problem, with a serious one like a psoriasis or a very serious eczema or skin cancer, obviously, and then there's more intervention. But I had a child that had eczema. Did I get any help from the allopathic doctor? No. Took him to a herbalist and a homeopath. And the child had the necessary treatments. He was really small. He had a reaction. He went redder for a day or two, and then it never really came back. And now he turned 28 yesterday, and his eczema has never returned. So whatever it was, it readjusted the system. He would have been living with that for heaven only knows.
Yeah, and eczema and today's topic, which is acne.
Yep.
It affects us in such a deep way. It affects our persona. It affects how we are in the world. But it also is speaking to a problem within the body itself. And it doesn't get solved by only doing external things.
No, quite the opposite. It is very internal. And I think once something like that happens, the emotional component of it is almost equal, if not worse, than the physical. Acne as we're going to talk about, is a horrible thing. And when you see a young person, and we're talking about women here, or when you see a person, you go, oh, poor, you feel for them, you feel for them, because most of the time they'd like to be hiding under a light, not going out, because it's unsightly, it looks painful, and it is painful sometimes for them.
Yeah, very much so. And it's scarring, so it's there with them for life quite often. So let's introduce ourselves. What do you say? Hey,
what a good idea. You can go first this time. I went first.
Sure. So my name is Chitra, and I'm a doctor of Ayurveda specializing in women's health, specifically perimenopause through menopause and beyond. I write Art of Menopausing here on Substack, and I just realized that this month I am on Substack with my newsletter, post, whatever, my Substack thing with Art of Menopausing for close to a year now. So this is my year anniversary month, which is kind of amazing. And we have been doing this for, close to 20 times or so. We've done 20 weeks.
Yeah.
Somewhere within that. So yes, I'm about to start celebrating my launching of Art of Menopausing.
It's so good. So good. And we were saying earlier, this is the conversation we're so grateful to have. And there's a space to have it. I'll introduce myself. I'm Clarissa. I'm a Chinese medicine practitioner. And just like Chitra, I specialize in women's health, mostly focused on the menopause, perimenopause, through to this other side of life that the Chinese like to call the second spring. And I write Heart of Menopause here. So we are heart of menopause, menopausing in our lives.
Yes, I made that word up, menopausing, because this, once it's paused, we're living for the rest of our lives. And that's the point, is to have our health and be as optimal as possible for as long as possible without having to suffer the symptoms of menopause. And like we were talking about the acne in a teenager, how it lives with them for the rest of their lives. And the same is true for menopause symptoms. It can live with some women for the rest of their lives, but it doesn't have to.
Yeah, and it doesn't have to. And I think we're also here to say that there isn't one way to menopause. There are many ways, as you're an individual, because it's always individual. So you'll hear us talk about lots of things. I'm sure we'll be there today talking about lifestyle and diet and rest and all those things. But how it actually plays out specifically for you is always individual. In Ayurveda and in Chinese medicine, there isn't a one way is the highway and we all do this, because we've all started from a different base. We come from different parents. We have different experiences with different doshas or constitutions. We have different imbalances. And so the advice that is specific for you has to be given specifically for you. But the overarching things are the things we talk about, which are good principles to follow.
Yes. And part of the way we speak about it, at least the way, and you do as well, is because undergoing menopause or any disease, not that menopause is a disease, it can be for some, the after effects, the underlying issues around it. But anytime we're talking about any symptom, it's difficult because it's also personalized. It's difficult to speak about it. So we break it down into various ways. So, and these are basically buckets. So within Ayurveda, we're talking Vata, Pitta, and Kapha, which are 3 buckets, and then there are other buckets that are underlying them. In Ayurveda, we've got 5 elements. And the same is true in the Chinese system, where the buckets could be the elements and or yin and yang and the dampness and the heat, right?
Yeah, and phlegm and all of these common things. But we do essentially have a baseline constitution aligned to one of the 5 elements. You're usually predominantly one of those, but you're obviously a mix of them. You're not one constitution. And then we look at the imbalances that are occurring within the organs of the body. And all of that is wrapped around the life season that you are in this case, perimenopause, menopause, and the season of the year, because things change as the year cycles round. So there are lots of different factors. The climate matters.
How far away you are from the equator.
Oh, yes. Yes. Climate matters a lot, actually.
Yes. Just as in anything, it's whatever you surround yourself with, right? So they say that you are a composite of the 10 closest people around you, right? And you're going to behave like those people, and you're going to start thinking like them, and you're going to learn like them. Well, the same is true with these unseen forces. Sometimes they're seen, sometimes they're not. So right now we've got climate issues happening, and so there's rapid changings of unknowns and extremes, and that is the soup that we live in. So what that means is that we have to be more aware of what is happening right now in order to modify. But
Exactly.
That's enough of that, like overall. We're talking about acne. Last week we spoke about the skin, and there's some overlapping concepts, but we're going deep into it. And in menopause, what I hear most often is like, what the fuck?
What just hit me here? Yeah.
Whether they had it as a younger, an adolescent or not. Some who had it in adolescence don't have it during menopause, and others it's the opposite. Some poor people, they have it both, and others never get it.
And some it never really fully went away. It died back a bit and then decided to come back. So acne is seen in the West often as hormonal, related to an excess of androgens, so testosterone in the body. And it can certainly occur at any time where there is endocrine disruption. So teenage years and puberty, pregnancy, perimenopause, it's often seen with people who have PCOS, polycystic ovarian syndrome. It can also be seen just through your normal menstruation cycle. So it really is something that affects some women. And that's about what I would say the West is pretty much saying about it. But, Ayurvedic and Chinese medicine go a lot deeper into the underlying root causes and imbalances for acne, and therefore open up, I think, a bigger opportunity to find ways to manage it more effectively.
Yes. Yeah. And I think that there are some other things that they're looking at as far as the West is concerned beyond the hormones. They're looking at hygiene. They're looking at oily foods or chocolate, things like that. And there is some truth to all of these things, but it's just not the whole picture. And so last week when we were talking about the skin itself, we from an Ayurvedic perspective, we spoke about the digestive system, and that the skin is a reflection of what's going on in the entire digestive tract, because essentially they're the same tissue. One is an internal tissue, the other one is the external tissue, and they both filter the external world from the internal world. So they have the same function. The other thing that we see in Ayurveda is that it is closely related to the blood. And so the blood, the red blood cells in specific, the red portions of the blood. And so, which is how we get the coloring on our face. So we know that if we don't have good color, in the face, we don't have a shine, then something is going on with the blood itself.
Yeah. And there's a lot of truth in that in the Chinese medicine. It usually is digestion, yes, but also the kidney and liver, and of course the liver is a digestive detoxing organ. So it often imbalances too much heat, stuck energy, stuck chi in the liver will give rise to skin related issues, and chi and blood, what we might call stagnation in the body. So the blood isn't flowing. You're right. We don't have that nice, healthy pink undertone, whatever color we often have that. And then when blood is stagnant, then the chi, which is the energy component of the body, that will also be stuck because chi needs blood to flow. So you're getting, a body that's just congested, really. And then all that heat and substances that would be moved around would be digested out of the body. They have somewhere else to go. And the skin, of course, is an excretory organ. And so that will come out in the skin.
Yes. So before we continue, I just wanted to welcome John. Welcome, John. I appreciate you being here. We appreciate you being here. And it's even though we're talking about menopause, everyone can have acne, and male, female, it doesn't matter. It's just within menopause, we've got that additional factor of fluctuations of hormones, which are sometimes, and decline of hormones, which sometimes exacerbates it all.
Indeed. And I think that when we go more deeply into the Chinese medicine part of it, we start to see that there are real nuances, which we can see what the underlying root causes are. So it's easy to say it's kidney and it's liver and it's blood and chi, but actually how that's playing out within the organ systems is incredibly detailed, I would say. And I'll talk around some of this as we go along in our conversation, just to mention that one of the best ways for detecting that in the Chinese system is called facial mapping. Mian Si Ang. I mean, I've just butchered the Mandarin, no doubt, but actually, it's like for over 3,000 years, the Chinese have been looking at faces and seeing that as a reflection of the body, but where the acne is most dominant. And if we look at people who have acne, they don't have acne usually over the whole face, they'll have a part of the face of them. That gives really deep clues as to where the imbalances of the body are most acute, and therefore gives you opportunities for variety of treatment routes.
Yes. I remember when I was early on, probably the first time someone connected me with Ayurveda. And this is early in like going into organic foods, holistic health, many, many years ago. I would get acne in right here. And it wasn't really bad. It wasn't acne per se, but certainly whiteheads. And someone looked at me and he says, "Oh, that's too much fat in your colon," which is a similar way that Ayurveda sees it. And we've over the weeks that we've been speaking, the months, we realize how closely connected. It's just that Chinese medicine has brought out some different things than Ayurveda has. So the facial discoveries or specific things like what you were talking about is not taught. That kind of diagnostic is not really taught very much. There are traditions that it's brought down through, but it's not really spoken about that much. And part of the reason is because the British knocked out a lot of the knowledge and the doctors, both male and females, so that they could go into take control of the medical system.
And I would say in the Chinese system, tongues and pulses remain the number one point or areas that are used to measure. So pulse, you will find that the acupuncturist or the herbalist will take your pulse, and their pulse is not to see whether it's just beating. They're looking for the depth and the flow of qi, and the tongue is also a map of the body. But tongue diagnosis really only work first thing in the morning before you've brushed teeth. So I sometimes wonder why an acupuncturist asks you to do that at, lunchtime or in the afternoon. It only gives because you're really looking for the state of the tongue first thing in the morning.
Yeah,
but it sort of helps a bit. I don't know. I mean, it probably does, but
that's the traditional way, because it will show up a lot of things, but it is rare that we will be able to see, because I use it all the time. It will be rare that we will see it, a tongue first thing in the morning, unless you're in residency with me doing a panchakarma. A picture doesn't work either because it's flat and the colors are always off. But here's the thing. We make do with what we've got, so to not to discount that particular diagnosis because it's not done exactly at a specific time of the day before and after the tongue scraping, whatever those confines are, because we are never going to be able to do what those ancient people, what those people were able to do.
Yeah,
so,
that's a fair point.
It's valuable. There are shapes and colors and sizes that we can tell, and ridges and landscapes within the tongue that we can tell conditions. We may not be able to get as specific as those people, but then again, we don't have the same tools to deal with those specific things in the manner that they did. We do it in our way. Yeah. It's just like I was just filming a video for my membership where I was talking about fresh food, right? So in Ayurveda, one of the biggest things about Ayurveda and food is that it has to be absolutely fresh, no leftovers, no frozen food, no, and the truth of the matter is what kind of compromise we have to compromise.
Yeah,
we don't have a big family to cook. We don't have the person who's cooking is often doing all of the other things as well, plus working outside of the home, or they're single, or they're whatever circumstance there is that that having to say no leftovers at all is a burden. So what are you going to do? Not eat, or just give up and just eat whatever junk food is available, right? So
it's compromise. And I think I understand the tongue is a compromise, but I'm also going to say to that is very few acupuncturists have had facial mapping training these days. It's almost like it's a separate thing. And yet looking at people's faces in combination with tongues and can give a lot, because the face, unless it's covered in makeup, of course, or whatever, may well show some of the things that you might miss. So I think it's probably more about using all the available tools you have with you. And the face is one that tends to not be done unless the person has had training in that space.
Yeah. You know what? This is so we haven't even gotten to the acne, but you just reminded me. Lately, I've been watching some older movies and then wondering what happened to those actors and whatnot. So I've been comparing their facial skin to past to present, and this is what happens with menopause. So we're comparing our memories of what we used to look like, and then being hit in the face with what's there in front of us, whether it's on video or not. And what I'm seeing a lot is unevenness in thickness, or there is an underlying I don't want to say fat. It's not really fat. It's a toxin kind of level underneath the skin that you can actually see, and it's creating all kinds of bumps underneath. It's not breaking the skin like acne does, but it's underneath there, and it's often red and blotchy and things like that. And so this is, we can almost look at that as an initial stage to some of what we're seeing as far as acne and menopause.
Yes, definitely. So, I mean, when I'm looking at a face, and I look a lot at the forehead and around the nose, here on the chin, and then the cheeks. But this part of the cheeks tends to be more the lower part of the cheeks. But it's even important to look whether it's left or right or both, because all of those are going to give indication of the underlying imbalances. And I think what's interesting is how many of them are related to, as we said, digestive issues, and things that we expect also can be a consequence and a root cause of changes in our energies, our yin energies, as we go into menopause.
So in Ayurveda, I'm going to talk about the doshas again. And acne by doshas on the skin, because each, so we see acne differently based on the doshas. And the pitta dosha, which is the fire and a little bit of water, made of earth, of fire and a little bit of water. I already said that. Whoops. That shows up more like the inflammation, redness on the skin, and what we typically think of as acne, where it's red and it's exploding. So think of volcano, it's that kind of fiery explosion of the under earth, always looking to see it. A lot of Ayurveda, at least initially, looked at the external world, the natural world, and made a connection to what's going on in the physical body. For the kapha, we get acne because of the oily and the clogged skin. Okay, so whatever is underneath is too thick or too dry, kind of like oil on a bottle, when oil gets dry on the bottle, to fully come out. And so underneath it, we get that fire trying to push it out. So it's slightly different. And then for vata, it's usually caused by dry, flaky skin and irritation, which again goes to clog the pores up, and the fire comes out. And during perimenopause to menopause, we're already moving from the fire time of life to the dry time of life. So this is another way to look at acne beyond the hormonal perspective.
Mm-hmm. And that would be the same here, but a lot of it is about heat and excess heat in the body. So in the forehead, we're seeing particularly heat fire, so that heart system is hot. In perimenopause, what you have and what you normally have in the body is a relationship between the heart system, which we know is bigger than the heart, and it's pericardium and it's the small intestines, and the kidney system, so the urogenitory system. And one is fire and the other is water. So in the laws of yin and yang, they are working and balancing with each other, and you've got harmony between fire and water. But if, as we know in perimenopause, you're getting a decline in that yin energy in the kidneys, so there's less water, so there's more dryness, there's more heat, it rises up, and you tend to find that it's a good example of a heart-kidney disharmony when it breaks out here, and that then is in a vicious cycle because it's often related to poor sleep, which we've talked about in perimenopause as being something that happens due to heat, hot flashes, night sweats, hard to sleep. And of course, this is real stress related. And we know that women are often under a lot of stress and pressure for lots of reasons. And so that's where you get the acne there. Whereas the heat you get around the nose, well, that is stomach fire heat. And that is when our diet, and here we go with our diet, becomes it's the cold raw food. Strangely enough, causes the stomach fire to not work. It sounds illogical to people in the West. It's like, not to you, but if I said to you, you're eating cold raw food, and then next minute you're getting a heat. There's a lot of work for the stomach to digest this. You're getting a lot of heat. And then at the same time, you probably also got a diet that has too much spicy food, too much greasy food, too much processed food, all of this stuff, which unfortunately is a bit of endemic in our Western diet. I mean, 60% of many Americans' diet, at least, is processed now in a way that's not good for them. And that will then lead to stomach fire. And that is, so there's fire in the body, but you've also got a decrease in fluids in the lower intestines. So you get constipation because there's not enough bowel movement. And that's a sign that your bowels are not working as they should. You have constipation or you're leaning that way. And there's a real need for a shift in the diet here. So those are interesting, and you need to have much more water to drink and much more fiber in your system. But both are fire. This is a different kind of fire to the fire in your stomach, but they're both leading to acne that is, sometimes here I'd say they're more like pustules, whereas this is more of the red inflamed across the forehead.
What about, what does Chinese medicine see as far as the, like the chin and the jaw area? Because I see that quite often.
That's kidney yin deficiency. That is the most related, and it is the type of acne that we would say is very common in menopause, in PCOS, women who are on the birth control pills, can happen during menstruation, and it is the yin in the body, and particularly the kidney yin is deficient. So it would be a classic form of acne in perimenopause and going into menopause.
Gotcha. So in Ayurveda, we have similar causes of acne, and so in Ayurveda we call a cause hetu. Hetu is the name of is the Sanskrit word for causes. And that's what we're always looking for, is the root cause. And the first thing that we look at is ahara and vihara. Ahara means food. So good food and bad food. Basically. So this is what we're looking at. So in Ayurveda, we see that if we have excess of certain types of tastes. So if the tastes that are excessive, which are also increases the pitta or the fire, which is the sour, the spicy, and the salty taste, that's going to increase. So So if that's the vihara, the bad food, then the good food that you want to do is increase some of the sweet taste. And I'm not talking about sugar. I'm talking about grains, inherent foods that are inherently sweet and build the body. So we're looking at sweet, bitter, and astringent. But we have to be careful during menopause because those are all things that are going to increase vata. So the truth of the matter is you want to have a good balance of all 6 tastes, but really watch that sour, spicy, salty. So if you have bar food, let's put it that way, or fried foods, which all have those, the sour, the spicy, the salty together, that is going to create it. So heavy foods, meaning foods that you can't digest, too much, perhaps meat, or or junk food, or oily foods, excess fermentation, which is high fire, that's going to do it. Incompatible food combinations. So that's a big thing because the body gets confused. It doesn't know what to do with the food. So a classic example is milk or a dairy product with fish. The reason for that is because fish tends to be oily, lives in the water. So that's kapha increasing. That's the whiteheads that will come up. And milk has that same consistency. So you're doing double duty there. And that's what makes that an incompatible food. Some people can digest it, if you're in the right climate. Some people can, but not as a regular part of your diet. And then the other one is yogurt with sour fruit, because yogurt is technically heating. And so it's creating a conflict. It's not that you can't do yogurt with all fruit. It's just that you want to, especially with the sour fruits. So in the United States, we have a lot of yogurt and strawberry together with granola, and that's considered a health food. And this is actually really, really difficult to digest. And you'll notice how full you feel afterwards. And some who cannot, and that's one way to discover whether it's heavy or not. And some will actually fall asleep after it. So the other thing, like you said, irregular sleep, that causes wreaks a lot of havoc in the body. We also say suppression of urges. So there are 13 major urges that we look at, and that are violations of the intelligence of the body. And the 3 that we're really looking at in terms of acne is constipation, or not going to the bathroom when you need to go. When the body is ready to push out the feces and you suppress that urge, doesn't mean that then that's going to cause a buildup of toxins. And it's going to have to come out somewhere and somehow. So little particles are just not being appropriately released at the right time. Urination is another one. And of course, sweating. So all of the elimination processes that can cause, that is a early cause of the acne. And interestingly enough, now that I think about it, when you are in high school or you're just hitting puberty, that is the thing. Those are the things that you're actually suppressing. It's like you have to hold up your hand in order to go to the bathroom. And the teacher may or may not let you do that, so that may be an interesting way to change the school system.
And girls who don't like to poo in school toilets, because somebody might hear it.
Yeah.
And there's lots of girls I know who do things like that. And of course, then there is that option that it can come out.
Exactly. And then, of course, there's environmental toxins, excess exposure to dust, pollution, cosmetics. Women, perimenopause, menopause, they are slathering things on their faces that they cannot eat. And if you cannot eat it, that means you cannot digest it, which means that it's going to create further clogging and issues. And of course, we've got the emotional stress, anxiety, anger, because that fire is part of it. Yes.
Yeah, definitely. And that's where you get the liver relationship in Chinese medicine. What I also meant to say that the ones that come here on the cheek are also liver related. So there's that irritability, the poor sleep, the being awake at 3 a.m, we're not processing food properly, but also these can be lung. And of course, we talked about the lungs before when we talked about the skin, and that can also be grief. That's an emotion associated with the lungs, and that we are maybe not in Chinese medicine, I'd say, caring for our lungs. Our breath work is very poor. In the West, people tend to be upper respiratory breathers and not really filling our lungs, and all the breath work that I think Ayurvedic and yogic traditions are much better than Chinese traditions. We have a tradition of breathing, yes, but not breath work that is as detailed and many times. So this is also that we may need to be thinking about our respiratory health as well as grief. And what the Chinese would say is moisturizing the lungs. So we want foods that have affinity to the lung, that give them a sense that they're not dry, that there's moisture here, because dryness and the lungs belong together. So I mentioned my wonderful snow fungi, and they are also pretty good for people who have acne. There are various sort of meals that can be eaten with snow fungus, with pears, very moisturizing. Pears are also a fruit for the autumn season.
Are we talking the great
we're talking
the Chinese apples? They look.
No, we're talking pears, real, Western type of any type of pear would then work. It's very much seen as a moisturizing autumn food, which when eaten with the snow mushroom in these puddings that the Chinese love, that's very good for the lungs, and that can also be part of a treatment for this if the acne is here, particularly on the right side of the face.
Yeah. So in Ayurveda, we are also looking at like a pathogenesis. We were talking about what are root causes, but how it flows into becoming acne is there's a 4-step type of situation before we even deal with what are the treatments and food and other practices. And welcome, Sylvia. Thank you for joining us. If you have any questions about menopause, Ayurveda, Chinese medicine, and our topic of the day, acne, feel free to put it into the text. So the pathogenesis, the way we see it working through is, first of all, the doshas themselves, they get vitiated, meaning that there's too much of them, and that happens based on food, environment, all the things that we've discussed. They also move out of their home territory and start displacing things in other places. And then what we see is a blood impurity. So which is the liver may not be functioning in the same way, or the digestive system hasn't processed everything properly. So it's this combo situation where the red blood cells are not are not clean enough, and if they're not clean enough, then we also don't have appropriate oxygenation. So it's a similar thing to the Chinese medicine. And then we're looking at, so when all of that is happening, that means that our digestion has slowed down, which means that we have undigested food stuff / toxins in the system now. And then what happens is that the channels to the skin gets blocked, and then it moves on out further and further. So that's the way we're looking at it. And we can catch the acne as early as possible if we know what to look for. Unlike Western medicine, where it's like, oh, you have the symptom, now let's go deal with it. Whereas we can catch it so much earlier.
Yeah. And I think we would see those imbalances appear before they appear on the skin too, in the Chinese. I mean, we would be looking at the poor sleep. We would be seeing the constipation. We would be noticing that people have certain levels of fatigue and tiredness, the heat in the body. Those things would be there before that. The chi is obviously, it moves up and down and in and out, but there's levels to how it moves out. I mean, it doesn't sort of go from in the body to straight out of the body. Everything has symptoms and signs along the way. But when they're left untreated, then when it appears on the skin, you've really the chi is then moving outwards. And after that, there's only your Wei Qi field, which isn't a physical field. That's more a barrier that's keeping stuff out from you. So it definitely is detectable and manageable before we see the distress of physical acne.
And there is something to be said about cellular memory. So the body, if say this happens to a woman starting at puberty, or maybe not during puberty, during her menstrual cycle, or during pregnancy, the body will remember to expel those uninvited, unwanted toxins, for lack of a better word. It will remember, oh, this is the way we can do it. And so it will move into its old habits as well. So women during perimenopause, menopause, I always say, well, expect it and let's deal with it now before it shows up.
Yeah. And I think that and I wrote about this earlier this week, that in the West, we sort of think that menopause kind of appears and happens. But really, from the age of about 6, 7, everything we do all along those 7 times 7-year cycles in Chinese medicine, pre to becoming an elder, each of those builds on the one that went before it. And so it's really important that in many ways we start girls off on a good basis with nurtured bodies that give their organ systems that aren't fully matured in the Chinese sense, which is your spleen and your kidney system, the chance to develop, that we take the time at menstruation, that we have postpartum recovery. Not how many weeks is it in the US? 6 weeks, and then you're going back to work or something.
What do you mean 6 weeks? 3 days. Back to work. Kidding.
And you're still emailing in the delivery room. but all of those things, and then so the perimenopause is there. And if we haven't built that cellular member, if the body doesn't know how to meet and manage these things, then everything feels like being blindsided all along the way.
Yes, exactly. So let's get on to some remedies. What do you say? A little bit about food.
Yeah.
Do you have? I'm of the nature of for this is to look at the heat factors of it, whether it is heating to the body or not heating to the body. So we are currently in the northern hemisphere in autumn, where most of our foods, we're starting to add spices into our foods. And so most spices are heating, whereas in the summertime we were using cooling herbs
Mhm.
for the system, so we're, go into the foods that are seasonal. That's going to help. And also you may want to, as far as internal foods, um, you may also want to look at something like aloe to digest. We know that aloe is really good for burns on the skin, but it's also really good internally. In Sanskrit, the name of aloe is Kumari. Kumari means princess.
Oh,
So,
yeah.
so this is kind of like the queen princess. It's not quite queen. No, is it queen? It's queen, excuse me. It's the queen of herbs. And so, yes. So it is meant to cool down the system because women tend to have more heat within them as the sex itself, because we have more fatty tissues, because we have to create another human being in our body in order to create transformation and transmutation. We need energy, heat to do it. So,
Yeah.
but sometimes there's too much heat, and so cooling it down. So Kumari is a really great one to use in the skin and as well on the skin. But Chinese medicine, you always surprise me with
Oh,
like
that's all.
things like pears and black
Pears
foods and
and
things
black
like that.
food. I mean, a lot of it is the same. It's eating to the season. It's not eating to the extremes. I mentioned cold raw foods, and that's not just vegetables. That's, reach for these dairy smoothies and all of that. And I'm like, those are not helpful in this space. Neither is too hot and too spicy. But we're eating for the season now. We're in warming foods and warming cooked warming foods will be very nourishing to yin, because if we have some of these, particularly depending on the chin, and we're yin deficient, we want to be adding cooked warm foods. Bone broth can be good at this time of year if you're a meat eater. The usual, but I think some of the others, there are licorice root for this one here, very good to add. There's some special tea formulas using lotus related petals that can also be very, very cooling. And then it's the usuals, the danquays and leronquis and there are some others, shu de hung, they're kind of herbs, but they get cooked into the food. So often they're the same sort of things that come around. But because they may be balancing for the endocrine system, they're also very helpful in the hormonal acne. And again, it's things in moderation for the time of year, more cooked than not, and no extremes, because you're trying to actually get the system to be less fiery, mainly, and also that food should process and digest. And of course, the body clock comes into play, that we're eating the right size meals at the right time of the day, that we're not eating lots of food, so we have lots of undigested food in the system when we're trying to sleep, which creates stagnation.
Yeah. So it very, very similar foundational concepts.
Yeah.
So in Ayurveda, we also are looking at what can we put in the body as well as on the body. And we're always looking at these various herbal combinations. So internally, turmeric, anti-inflammatory. We know this one really well. So you can take turmeric. I already spoke about aloe vera, fenugreek. Fenugreek is an amazing anti-inflammatory, whether you're using the leaf or the seed. And if you're going to use the seed, internally. I suggest that you cook it in a little bit of ghee. Ghee is also very cooling. It works with the fire. And then put it on some sort of vegetable. Or you can cook it in so many different ways. And then there's what we call triphala. Triphala is a 3-fruit um, herbal medicine which assists the body with the constipation. It's actually pretty balancing for all the doshas, and it's got a high vitamin C content in it because it has Indian gooseberry, which is called amla. And what that does is, she's Ayurveda cat. What the amla does is that it's an it's an cat has taken away the words. Antioxidant is the word I'm looking for. So anything that's going to bind that and remove it out of the system is also going to help the skin. There are three other herbs that I'd like to talk about. Now, these can be put in the body as well as on the body, and I'll talk about some things that you can do for on the body. Um, I was speaking about cleansing the blood earlier on, and there is one herb that is considered the blood cleanser, and that in Ayurveda, and that's called Manjista. Manjistha.
Yeah.
It's bright red in color. So anything that's bright red, that they're kind of like, does this work? But it does. It helps cleanse the blood. And anytime we are looking at acne, that's what we're looking to do. It may not be the first herb that we offer for blood cleansing, but it's certainly part of a formula. The other one that we look at is Arjuna. And Arjuna is traditionally known as a heart remedy, but it's also a really good blood cleanser. And for those of you in the West, hibiscus is another really great blood cleanser, and it's also high in vitamin C. So if you just started taking the hibiscus as a tea, that would help. So anything that I've spoken about can go onto the body as well, go onto the skin. And number one that's going to clean up that oiliness is neem.
Of course.
So neem is super bitter. So you can take it in the body, or you could put it on the skin. Yeah. So that is those are the herbs that we're looking at. And then, so of course you can make face masks. And I'm not talking about the face masks that you now get that have plastic kind of weirdness on it. These masks are like driving.
Yeah.
So you can do a mask of sorts, where you make a paste of herbs or combinations of the herbs, and you can make the paste out of that aloe. You can make paste with honey, because honey is also going to draw out things. A really popular one is sandalwood, turmeric, and honey. But people don't like that orange color with the turmeric. So you can also use cinnamon instead of that, because it'll draw out the heat. Fenugreek powder will draw out the heat. You can even use tulsi, which is very calming, cooling. It's a very nice thing. Then you can create a scrub, and putting these herbs into the scrub. And we're not using sugar scrubs. We're not using salt scrubs. Salt is heating, so we don't want to add that. And the sugar scrub is sugar, which is excess kapha again. It's so you're aggravating two of the things that we don't want to. What we use is something called besan. Besan is chickpea flour.
Yes.
And so you can make a scrub with the chickpea flour using all of these things. And another really nice scrub is to take neem, turmeric, and rose water. Rose water helps cool things down. In that chickpea flour, put it on the face, let it sit for a little bit, and then scrub. It has to be watered down with something, obviously. You can't just put the powder on the face. Yeah.
But in China, in North Asia, you would see the use of rice flours and rice-based scrubs with a combination of herbs. Sometimes essential oils would be added in. So in similar ways, just using a different type of flour, there would also be these gentle scrubs that can be used.
Yeah, exactly. So those are some really natural ways. They're not terribly expensive. It's not a single use scrub. It's not what is alpha lipoic acid? Is that what's being used on?
Yeah, I think so.
Sorry.
I don't know what they're called.
No, alpha lipoic.
AHAs or something.
The
alpha hydroxy acid.
Alpha hydroxys, all kinds of different, anything with the acid. Even name, it's when you hear the word acid, know that the possibility exists that it's going to heat you up. I think I tried an alpha lipoic acid on my skin because it was part of my job, and I immediately got acne from it when it was supposed to do the opposite. But anyhow.
No, and I think no, they're just horrid. They're horrid, they're too strong, they don't support the skin, they're heating, and they aggravate.
Right.
And they're expensive. I mean, there's so much, as you just shared, that we can take from both traditions that are internal and external. Of course, in Chinese medicine, acupuncture can be a very effective route alongside these to get the qi and the blood moving in the system, and that tends to be something that comes in combination with that. And you can use acupressure in the ankle areas on liver points as well. That will also, again, gets the stagnation in the system moving.
Yeah. And here's the interesting thing about doing something too harsh to the body, or not enough, because you're always looking at the balance, is that with acne, you're also always looking at scarring, possible scarring. And what scarring is the body is trying to cover or mend any sort of tissue, whether it is muscle tissue, in which case you're building muscle. That's what's happening, is you're scarring the muscle. But with acne, it's trying to mend the skin again, and therefore we have some scarring happening. And if we go too harsh, what happens is the body activates its system. It's like, Mayday, Mayday, my skin is on fire. Got to do something about this, produce new skin. And for a little, it might produce good new skin, but it's going to be different from the original.
Yeah.
And scarring does happen, or discoloration, which can be a form of scarring, depending on where it is. So you want to have the right balance. If you're doing these, especially some of the more gentle, not the neem, which can be a little harsher, but if you're doing some of these more gentle, sandalwood, turmeric, honey kind of thing, your skin will go, okay, it's not on fire. I can create new skin cells without having to create the scar tissue to quickly glue it together.
Yeah. Yeah. So there are lots of natural roots, I think we've said, and there are lots of root causes as to why acne occurs. And that we get, I think the most important thing, if anyone was to take away, was we're usually getting the signs that we're out of balance in some way long before the acne erupts. So that almost feels like that's kind of the end point, and now we have to do something about it, where we've ignored and brushed other symptoms aside. It's harder to do it with the acne, but we don't have to end up there if we're more listening to our bodies and taking note earlier along the way, because we're getting the messages. They just maybe are subtle, and sometimes we don't think they're convenient.
And when we're looking at the internal things, it's going to assist overall health. So it's not only going to help prevent acne, it's going to also support your digestion. It's also if we're looking at fire because of acne, we're also probably looking at fire in hot flashes. We're also maybe looking at fire in graying of the hair, or hair fallout, or eyesight issues, or there are just it's one integral system. So you're not doing something separate. It's not an additional thing. It's you take care of your internal digestion constantly. And yes, you're supposed to take care of your skin anyhow. You're cleaning it, right? So, you may do something different with these herbs than you normally would, but it's not special. You can do it for your entire life and there won't be any harm done. You will only enhance the quality of your skin, which is something you need later on, because there are many, many people who are on blood thinners for various reasons. And so as we age, perhaps, you need to take care of the skin for that eventuality, because as we age, the skin inherently gets thinner. So that's what I want to convey today too, is that it's not necessarily something special for us Westerners, where we're used to being spot treatments, basically.
For everything.
Right? We're doing a spot treatment. You get one of these habits in on a regular basis. So you're doing your facial once a week. That's more than enough. It doesn't have to be you don't have to do it every single day. You can if you want to and you have the time. They say that women spend at least an hour on putting on makeup every single day. So, yeah, that was, a lot, especially the younger ones who now have like lots of different products and processes that they need to go through.
Yes. Well, not need to, but do. They're following it. Yes.
Or to an hour. Can you imagine? So instead of that, you have a little pot of pre-made honey and turmeric and rose water, or honey and sandalwood and rose water. You have a little pot of it ready to go, and you just put it on and then wash it off in 10 minutes. No big
We're putting a whole industry out of business here. if only.
I'm telling you, I when I see commercials, I'm being bombarded with nonsense. And there's one lately that, they start talking about menopause is hot. So wear this makeup.
Oh my God.
So they're selling a makeup, some sort of foundation for menopause. And I'm like, this just doesn't make sense. Fortunately, I'm immune to a lot of these commercials, but I can only imagine.
Yeah, and the money. But there are solutions that are simple, and they're often in your kitchen and bathroom cupboards.
Yes, exactly. Well, we've come to an end to another week.
You have. And if anyone has any questions, we'd love to hear them, any comments, we answer them. And if not here, then you can always connect with both myself and Chitra. Art of Menopausing at Chitra, and Heart of Menopause is myself. And we'd love to hear your comments or your stories about your skin on things that have worked for you or not. No, that's really sharing with each other is so important.
Because everyone goes through it differently. So might get ideas.
Yeah.
Or just release.
Yes, that too. Okay.
All righty. Well, have a blessed day, and we will see you next week on Art
We
and
will.
Menopause.
See you.
Bye.
Bye-bye.